Hello, my name is Joe Macbeth, and I am the President and Chief Executive Officer at the National Alliance for Direct Support Professionals. And thank you for joining today's webinar, The Role of the DSP and the Coronavirus, Part 4, with our medical advisor, Dr. Rick Rader. I just want to let everybody know that this webinar is specifically tailored towards the direct support workforce, the essential healthcare workers that we've come to know over these past few months. This webinar will be recorded, and we will add the captions to our YouTube page, and we will share it on social media, and we invite you all to share with your networks across the country, across North America. With that said, I want to once again thank Dr. Rader for his time and his support. Information is changing daily on the coronavirus, and we're so fortunate to have our medical expert join us to share with the direct support professionals what they need to know at this moment. So Doc, take it away.
Okay, thanks, Joe. First, I want to thank Joe and the NADSP for supporting the series of updates on the role of the DSP and the coronavirus. It serves as an ongoing commitment that the NADSP has made in the recognition and support of DSPs during critical times. In order to receive the long overdue recognition of the contribution and professionalism of DSPs, it's crucial and expected that your behavior, performance, and attitudes will be measured during a crisis. It's one thing to be seen cheering on a Special Olympics athlete crossing the finish line on a lovely spring afternoon. It's another to be seen calming down an individual who has been quarantined for 8 weeks and is trying to climb out the bedroom window. Thus, one of the aims of these webinars is to not only remind you of that scrutiny, but to provide you with the tools to achieve that needed success. When I was growing up, one of my favorite TV shows was Superman. This was back in the 1950s. It was in black and white, and our TV set was about 14 inches wide, but it held my attention. At the beginning of the show, it showed Superman flying through the air, and the announcer said, "Faster than a speeding bullet, more powerful than a locomotive, able to leap tall buildings at a single bound. Look up in the sky. It's a bird, it's a plane, it's Superman." So I want to borrow that famous opening and substitute Superman for COVID news updates. And it's true. The COVID information flow with fresh information, statistics, warnings, theories, and predictions can cross the global community at unprecedented speed. Information about a new treatment that is released in Paris at noon is being discussed at Walmart 2 hours later. The news is more powerful than a locomotive. It moves the economy, tests the power of governments, it separates families, mobilizes the military, and directs challenges and stress like we've never seen before in our lifetime. And while none of us have any superpowers, as my wife is quick to remind me, direct support professionals do have the strength, determination, stamina, and dedication to change the outcomes, at least for the individuals you support. Some of the material may seem like a review, and it's intended. You have to know where you started to appreciate where you are now. And that is the definition of an update, where we've been and where we are. And this certainly will not be the last NADSP-DSP COVID update. Some updates serve to reaffirm some early insights, while other updates serve to negate and throw out earlier studies and practices. A perfect example of this is the early belief that the coronavirus was only transmissible through direct touch. The update, as you know, it is now communicable not only by contact, but by aerosol droplets through the air. By now, the early symptoms of coronavirus are well known. We call them the big three: fever, shortness of breath, and cough. The fever and cough were very reminiscent of the bread and butter flu, mainly attacking the upper respiratory system. But the coronavirus is a lung disease, and thus the symptoms of shortness of breath, of difficulty breathing, was the odd man out symptom. And just remember that a symptom is what the individual, the patient, experiences. A sign is what the DSP observes, measures, or elicits. For example, if the patient says that they are seeing double, that's a symptom. If the DSP observes a discoloration of the skin, that's a sign. While we use the terms interchangeably, and sometimes a sign is a symptom, it's nice to remember the difference. For decades, We use 98.6 degrees Fahrenheit as the accepted normal temperature. Scientists now tell us it's 97.5 degrees Fahrenheit, not 98.6, but there is a normal window of 97 to 99. Technically, a fever is defined as a body temperature of 100.4 degrees Fahrenheit or higher. A fever isn't necessarily a bad thing. It indicates that your body is doing what it should do in response to an infection. It's a sign that your immune system is doing its job, fighting off an invader like a virus or bacteria in an attempt to prevent it from overtaking your body. But a fever can be concerning. Aside from how miserable it might make you feel, with sweating, chills, headaches, and fatigue, it could indicate that a serious illness is developing, and an uncontrolled fever could cause seizures or brain damage. So it's important to pay attention to fevers and respond appropriately. It seems like every day we are learning something new about COVID-19. The latest update, there are more red flag symptoms than we thought. The Centers for Disease Control and Prevention has officially added 6 more symptoms to its list. The additions are chills, repeated shaking with chills, muscle pain, headache, sore throat, and new loss of taste or smell. These 6 symptoms, just 3 that were already on the CDC's list, fever, cough, and shortness of breath. These symptoms can appear anywhere from 2 to 14 days after exposure to the virus. There's been anecdotal evidence of some of these symptoms for weeks, particularly the loss of taste or smell. But now there's enough scientific evidence for the CDC to confirm their warning signs of COVID-19. In an analysis looking at 600 people who had contracted the virus, 60% of them reported loss of taste and smell. Although we don't know exactly the cause of this particular side effect, it's most likely due to damage done to the nerve cells in the nose. Think of it like how smoking or vaping can destroy the taste buds or sense of smell through direct irritation and damage to your mouth and nasal area. The vast majority of those who contract the novel coronavirus will develop only mild symptoms or none at all. Still, certain populations are more at risk than others of developing severe symptoms, and the virus is highly contagious. So it's important to continue to follow social distancing laws and to wear a face mask covering if you must go out in public. But if you experience any emergency warning signs, including trouble breathing, persistent pain or pressure in the chest, confusion, or bluish lips or face, you should seek immediate medical attention. And if you thought the loss of smell or taste was a wacky symptom, check this out. COVID toe. The toes look purple or blue and look swollen and feel painful to the touch. Sometimes seen in younger people, and sometimes it's their first or only sign of COVID-19. Similar lesions may also appear on the fingers, so it wouldn't surprise me if they start to refer them as COVID finger. And I know all of us would like to give a finger to the COVID virus. We're not really sure why this may happen. We do know that in the past, respiratory diseases caused by a virus also has skin-related manifestations. And not everyone with the symptom has tested positive for the virus, so it's not totally clear how or whether these lesions are directly related to COVID-19. It could also be a sign of recovery from COVID-19. It's obvious there's lots more we need to learn from COVID toe. Most of the folks with COVID toe don't have any of the traditional symptoms, but many test positive for COVID-19. We need to remember that COVID-19 is caused by a new virus, and there's a lot we don't know about it yet, including all the ways it impacts the body. There's also a host of new skin conditions associated with COVID-19. Like most viruses, COVID-19 also causes viral exanthem, or skin rashes associated with viral infections. We believe that 20% of COVID-19 patients will exhibit skin signs. It's not unusual for common viral infections to annoy the skin. Many viral illnesses, including chickenpox, measles, and mononucleosis, are accompanied by telltale skin rashes, often a result of the body's heightened inflammatory response while fighting off infections. Though more research is needed, a growing number of case reports and preliminary studies suggest COVID-19 also affects the skin. Patients who end up hospitalized often develop a pink, itchy rash across their torso and limbs. Others develop hives, or less commonly, a chickenpox-like rash. It's another opportunity for DSPs when helping someone to dress, shower, toilet, bathe, or provide routine health status observations to be sure to check the skin. Just keep to your normal instincts. If something wasn't there before, it might be worth ringing the bell. For those of you who are not familiar with this finger mousetrap, it's called a pulse oximeter, and it's used to measure how much oxygen your blood is carrying, also known as your blood saturation level. They can be bought at most drugstores for between $25 to $100. Why do blood oxygen levels matter? When you breathe in air, tiny capillaries in your lungs absorb the oxygen, allowing it to enter into your bloodstream. Red blood cells then carry that oxygen to tissues throughout the body, including your brain and other vital organs. A low oxygen level in your blood could lead to low oxygen in your tissues and ultimately lead to organ failure. Pulse oximeters may be useful because blood oxygen saturation levels that start trending downward could be a sign that your lungs are faltering and that you need to call medical attention immediately. There's little reason for the average healthy person to have a pulse oximeter at home, but there are some aspects of COVID-19 that could make one useful to people who have received the COVID-19 diagnosis or who have symptoms of the disease. That's because sometimes people with the disease have low oxygen levels even before they have shortness of breath. In COVID-19 patients, we often see that they look comfortable, but their oxygen saturation is significantly worse than normal. So a home pulse oximeter could provide valuable additional information about their disease. We call that silent hypoxia, where the patient looks fine, but their oxygen saturation is below normal. We tend to start to worry when oxygen saturation levels in an otherwise healthy adult get under 92%. People who use a home pulse oximeter should not fixate on specific numbers. Instead, use the readings on the pulse oximeter to get a general sense of oxygen levels and if they are trending up or down. And keep in mind several caveats. You should interpret the readings cautiously and not make any decisions based on them without consulting a physician. Even a pulse oximeter designated for medical use must be interpreted thoroughly in the context of other physical signs, like patient-reported symptoms and health history. Otherwise, the information may be misleading. For people at home with symptoms of COVID-19, DSPs really should be concentrating on things like fever, respiratory rate, pulse, cough, and if they're getting out of breath, doing the normal things they do every day. The pulse ox would be one more symptom or sign to add to those other things that may help make a decision about whether you should go to the hospital. Fixating on pulse oximeter readings may give you a false sense of security. That's because while in some cases oximetry may indeed identify lung problems before you have trouble breathing, it can also go the other way. You could be struggling to breathe but not show low oxygen saturation levels on your device. Normal readings are typically lower for people who live significantly above sea level. Other factors that can also interfere with how well a pulse oximeter works include moving while taking the measurement, wearing nail polish, or having darker skin or unusually cold fingers. There are so many things that come into play when evaluating a patient. Listening to the person and observing them, you can't really isolate only one thing. So I really can't say that the use of a pulse oximeter in group homes is advised. It certainly should not take the place of having a DSP who knows the patient, monitors the patient's individual health status, especially the small subtle changes that often announce difficulties before anyone else notices them. In terms of monitoring respiration, my money's on the DSPs. If the DSP thinks a person is in respiratory distress, they will call 911, whatever the oxygen saturation reads. A good rule to remember as a DSP is that we treat patients, not digital readouts. With COVID-19 now a global pandemic, the big question is, what happens next? One of the things that's being talked about is herd immunity, but what does that mean and how does it relate to COVID-19? Herd immunity, also known as community immunity, is defined as a situation in which a sufficient proportion of a population is immune to an infectious disease through vaccination and or prior illness to make it spread from person to person unlikely. In other words, where herd immunity exists, when lots of people in an area are vaccinated or have already been infected with the disease, fewer people get sick and fewer germs are able to spread from person to person. The CDC adds that even people who are not vaccinated, like newborn babies and individuals with chronic illnesses, have some level of protection because the disease can't spread within the community. The theory behind herd immunity is that when someone gets vaccinated, it's not only that person who is protected from infection, they can transmit the disease to other people. Herd immunity protects people who cannot be vaccinated because their immune systems aren't strong enough and are therefore the most vulnerable to serious illnesses. Of course, there's no vaccine for COVID-19 yet, so the herd immunity situation is a little different. The only option is recovery, which means letting the majority of people catch the virus at some point. Absent a vaccine to protect people against COVID-19, Waiting for herd immunity to occur is not a good public health strategy. Given the rapid rate of infections around the globe, public health officials in the US are looking to contain the spread of the virus by limiting person-to-person contact and urging the public to take steps to protect themselves and others. Here's an update from this morning. Researchers from Oxford University in England have developed what appears to be a successful COVID-19 vaccine. So far, it's only been tested in monkeys, but the results look promising. Plans to test it on 6,000 humans will begin at the end of May, so there could be a vaccine by the end of this year. So we certainly will look forward to providing updates in that particular news. Two kinds of tests are available for COVID-19, diagnostic tests and antibody blood tests. Diagnostic tests check samples from your respiratory system, such as swabs on the inside of the nose, to tell you if you currently have an infection, the virus that causes COVID-19. Any antibody blood tests, also called serological tests, check your blood for antibodies that would show if you had a previous infection. Antibodies are proteins that help fight off germs. A serological test may not be able to show if you have a current infection because it can take 1 to 3 weeks to make antibodies after symptoms occur. We do not know yet if having antibodies to COVID-19 can protect someone from getting infected with that virus again, or how long that protection might last. Scientists are doing studies to answer those questions. If you test positive for COVID-19, know what protective steps to take. If you test negative for COVID-19, you probably were not infected at the time your sample was collected. However, that does not mean you will not get sick. It is possible that you were very early in your infection when your samples were collected and that you could test positive later. Or you could be exposed later and then develop illness. In other words, a negative test result does not mean you won't get sick later. COVID-19 has had a major impact on our lives. Fear, anxiety, disruption, uncertainty, economic hardship, social reassignment, excessive attention to health concerns. Talk about a ready-made stew for stress. The individuals with IDDD may not understand anything about a virus, but they certainly understand when their world is turned upside down. They also take their cues from the DSPs as to whether they should be on high alert, survival mode, or there's going to be some needed but not permanent or unnecessary adjustment. Here are some tips for both the DSPs and the individuals who rely on the DSPs. Keep your body in good working order. Focus on nutrition, sleep, exercise, staying properly hydrated, and of course, good hand hygiene. Prioritize taking periodic breaks. Sometimes it's important to take a break and decompress for 5 to 10 minutes. For example, you could take a walk, sit still in a quiet space and close your eyes for a couple of minutes. Put in some earbuds and listen to some soothing music. Remember to breathe. Intentional breathing, slowly in through your nose and out through your mouth, can help you slow down and focus on the present moment. As much as possible, focus on one thing at a time. Prioritize working on the things you actually have some control over. Worrying about things you can't change wastes energy and doesn't change the outcome of the situation. Keep a healthy, balanced perspective. Manage your self-talk. What we tell ourselves about what's happening really does matter. Ask yourself, is what I'm saying to myself about this situation reasonable or realistic? Challenge all or nothing thoughts. These tend not to be accurate, and they can fuel feelings of anxiety. Challenge should thoughts. These tend to be counterproductive, and they can fuel feelings of anger or resentment. Be compassionate. Remember that everyone, including you, is doing the best they can. Seek out 3 good things each day to help balance out the negative. Celebrate successes, even tiny wins, throughout your day. Limit social media engagement. Limit the amount of time spent scrolling social media feeds or TV seeking more news and information about COVID-19. Instead, schedule device-free time to focus on doing things with your individuals you are responsible for supporting. In order to protect staff and preserve personal protective equipment and patient care supplies, as well as expand available hospital capacity during the COVID-19 pandemic, the Centers for Disease Control and Prevention recommends that dental facilities postpone elective procedures, surgeries, and non-urgent dental visits, and prioritize urgent and emergency visits and procedures now and for the coming several weeks. The practice of dentistry involves the use of rotary dental and surgical instruments such as handpieces or ultrasonic scalers and air-water syringes. These instruments create a visible spray that contains large particle droplets of water, saliva, blood, microorganisms, and other debris. This spatter travels only a short distance and settles out quickly, landing on the floor nearby operatory surfaces. Dental healthcare professionals or the patient. The spray also might contain certain aerosols. Surgical masks protect mucous membranes of the mouth and nose from droplet spatter, but they do not provide complete protection against inhalation of airborne infectious diseases. There are currently no data available to assess the risk of COVID-19 transmission during dental practice or to determine whether dental healthcare professionals are adequately protected when providing dental treatment using standard precautions. To date, in the United States, clusters of healthcare workers positive for COVID have been identified in hospital settings and long-term care facilities, but no clusters have yet been reported in dental settings or personnel. OSHA places dental healthcare professionals in the very high exposure risk category, as their jobs are those with high potential for exposure to known or suspected sources of the virus that cause COVID-19 during specific procedures. When practicing in the absence of airborne precautions, the risk of COVID-19 transmission during aerosol-generating dental procedures cannot be eliminated. Caring for patients requiring airborne precautions is not possible in most dental settings, as they are not designed for or equipped to provide the standard of care. For example, most dental settings do not have airborne infection isolation rooms or single patient rooms. They do not have a respiratory protection program and do not routinely stock N95 respirators. If emergency dental care is medically necessary for a patient who has or is suspected of having COVID-19, airborne precautions, an isolation room with negative pressure relative to the surrounding area, and use of an N95 filtering disposable rest for persons entering the room should be followed. Dental treatment should be provided in a hospital or other facility that can treat the patient using the appropriate precautions. If a patient must be seen in the dental clinic for emergency care, we systematically assess the patient at the time of check-in. The DSP should be asked about the presence of symptoms of a respiratory infection and history of travel to areas experiencing transmission of COVID-19 or contact with possible patients with COVID-19. They should ask if the patient is afebrile, meaning less than 100.4, and otherwise without symptoms consistent with COVID-19. Then emergency dental care may be provided using appropriate engineering controls, work practices, and infection control practices. The high risk of receiving dental care during the coronavirus pandemic should be an alert to DSPs that they must pay particular attention to maintaining a high degree of home-based dental care. This includes frequent brushing, flossing, rinsing, and asking specific questions about the individual's oral health status. You would have to be under a rock if you didn't hear that in order to be safe from COVID-19, we need to practice social distancing, staying at least 6 feet away from another individual. I dare say that 6 inches is also a long shot. Of course, this is impossible for DSP supporting people in group homes. The nature of human services is human contact. You cannot oversee a person's meals, personal hygiene, toileting, bathing, dressing, assisting with medication administration, adjusting leg and foot appliances, lifting, turning, and of course socializing without breaking the 6-foot rule. Heck, DSPs live in a 6-inch world. When it comes into play, might be when you venture outside for short walks. At our agency, we were quickly faced with the realization that our individuals did not understand, demonstrate, or practice an understanding of what 6 feet was. This becomes more and more important as we return to some sense of normalcy and return to the community. Without a vaccine, and that could be 2 years from now, even with lessened restrictions on going into the community, we will probably all have to continue to practice social distancing. Individuals with intellectual and developmental disabilities do not have the capacity to appreciate what exactly 6 feet is, any more than the smartest DSP would not know how to describe what 6 Scovilles are, what 6 Schmidgens are, or what 6 Mickeys are. The number 6 means nothing without understanding the unit. So in preparation for returning to what we used to consider normal, the DSP should begin to initiate educational programs designed to teach what 6 feet is. You can use chalk on the ground, ribbons or ropes, stretched arms or fence posts, cracks in the sidewalk, or anything else that can be used for a reference. It's a great opportunity for DSPs to use their creative powers. Of course, you have to remember that each individual might respond to different reference points, but DSPs know all about how important it is to personify and personalize lessons to meet the needs of the learner. By the way, a Scoville measures the hotness of a chili pepper. A Smidgen means small, and it's exactly 1/2 of a pinch or 1/32 of a teaspoon. And a Mickey, named after Mickey Mouse, is the length of the smallest detectable movement of the computer mouse, which is equivalent to about 1/300th of an inch. So now you know. During uncertain and emotional times, many people turn to a haircut for a fresh start or a feeling of control. But as appealing as some fresh layers might sound right now, it's not the best choice for the health and safety of yourself or the community at large as we work together to curb the spread of COVID-19. Because of a host of epidemiological factors, at least at this time, the last place you want to visit is a barbershop or salon. While many states are lessening their stay-at-home doctrines and many barbershops are opening up, I would advise avoiding them. Remember that no one has ever died from letting their hair grow long. Hair is also an acknowledged breeding ground for viral seeding, but you can address that with daily showers and shampoo. And don't forget the eyebrows when washing hair. There's a host of YouTube videos on how to give someone a haircut, and as luck would have it, there's plenty of time for a botched haircut to grow back. Be sure to disinfect all the grooming tools, including scissors, combs, brushes, clippers, trimmers, and razors. As information about N95 mask shortages continue to flood news outlets daily, people are beginning to create homemade masks in an attempt to protect themselves and frontline workers. But one question remains: can homemade face masks protect us from COVID-19? Experts say the evidence is not certain. According to the CDC, recent studies have shown that a significant percentage of individuals with COVID-19 lack symptoms, and that even people who eventually develop symptoms can transmit the virus to others. This means the infection can spread between people in close proximity, even if those people are not exhibiting symptoms. In light of this new evidence, CDC recommends wearing cloth face coverings in public settings where other social distance measures are difficult to maintain, grocery stores and pharmacies, especially in areas of significant community-based transmission. Although experts believe homemade masks offer minimal, if any, respiratory protection to healthy individuals, they recognize that there may be a benefit to wearing them to slow the spread of the disease during asymptomatic/pre-symptomatic periods. Similarly, masks can help symptomatic people protect others around them. COVID-19 spreads mainly through respiratory droplets produced when a symptomatic person coughs or sneezes. Homemade masks may be able to catch some of those droplets. Homemade masks should be used as a secondary step, in addition to measures such as coughing, sneezing into your sleeve, washing your hands for 20 seconds, social distancing, and staying home as much as possible. Some things homemade masks may be able to assist with are discouraging people from touching their nose and mouth with unwashed hands while in public, and catching droplets from coughs or sneezes if an infected person is wearing it. Healthy individuals should only wear masks if they are taking care of a person with a suspected COVID-19 infection. If they are coughing or sneezing or are in a public place where social distancing is challenging to maintain. Masks are most effective when used in combination with frequent hand cleaning with alcohol-based hand sanitizers or soap and water. In the workplace, the use of homemade masks does not substitute for an employer's responsibility to provide the DSP with an appropriate level of respiratory protection. Workers should learn and use the limitations of all personal protective equipment, and they should understand the limitations of homemade masks before wearing one. The WHO, the World Health Organization, recommends cloth masks be brought to a temperature of at least 133 degrees Fahrenheit to kill the coronavirus. As always, a soapy scrub is recommended and towel drying on high heat, which can reach temperatures between 135 to 150 degrees. Masks obviously cover the mouth, and that could be an impediment to people who read lips. There are masks you can buy or make that use see-through plastic sheets that allow the individual to read lips. Many DSPs have this false notion that they can just dab a little hand sanitizer on their hands, rub for a second, and go about their day. But that's actually not the correct way to use it. Instead, the CDC specifically recommends putting sanitizers on your hands, covering them completely, and rubbing them together until they're dry, which will likely take about 20 seconds, the same amount of time we recommend for hand washing. Studies show most people are washing their hands for at least 20 seconds, but the majority of people using hand sanitizers are done in less than 8 seconds. There is this cosmic belief that hand sanitizer is the ultimate virus killer, and it simply has to be on your skin. You'll also want to make sure that you're using alcohol-based hand sanitizers that's usually 60 to 95% alcohol. These products usually contain ethyl alcohol and isopropyl alcohol. There have also been questions about whether to use products labeled antibacterial or antimicrobial. The main difference between the two is the types of microorganisms they act on. Antibacterial products prevent the development of bacteria, but antimicrobial agents like alcohol-based hand sanitizers prevent the spread of bacteria, fungi, and some viruses. You should only use the ones that are antimicrobial. While hand sanitizers may help protect you from coronavirus, if you happen to get it on your hands, hand sanitizer is not effective against norovirus, C. difficile, and some parasites. Those critters can inflict major harm to an immunocompromised person. However, washing up with soap and water will help kill coronavirus and all those other germs. Bottom line is that hand sanitizers can kill coronavirus, but only if it is used properly, and it should never be your first defense. Soap and water and proper hand washing techniques should rule the waves. The coronavirus that causes COVID-19 may survive for several days on some surfaces. Estimates of its lifespan vary, but the viruses can clearly hang around long enough to make disinfecting frequently touched surfaces a priority. Normally, disinfectants like Lysol and Clorox wipes are available and would do the trick in cleaning most surfaces of contagion, but many of these items have been widely out of stock across the United States. If you cannot find any of these products, you can make an effective homemade disinfectant from a mixture of water and bleach. Whatever you use, it's crucial to know how to use a disinfectant properly. That means allowing enough time for a disinfectant to do its job, which can be as much as 10 minutes. Let's look at how to use these common disinfecting products. When disinfecting a surface, by far the most important consideration is what's known as dwell time. That's the amount of time the disinfectant needs to remain on a surface to kill pathogens, and in this case, specifically the coronavirus that causes COVID-19. No disinfectant works instantly. Most of those sold to the public take several minutes. Different dwell times don't indicate that one disinfectant is more or less effective than the other. That's just how long products take to eliminate the coronavirus. The result is that that's what you want. But dwell time is not the only thing you need to pay attention to. Complete disinfecting protocols include 4 steps: pre-cleaning, disinfecting and the dwell time, wiping clean, and rinsing with water. Pre-cleaning is most important on heavily soiled surfaces because dirt can shield pathogens underneath. It's fine to use soap and water or a household cleaner. Disinfecting for the proper dwell time, of course, is non-negotiable. Wiping afterwards is essential because disinfectants can leave a sticky residue where pathogens can quickly reassemble, and rinsing finishes the process. When you use a bleach-based disinfectant like Clorox multi-surface cleaner and bleach, it eliminates the coronavirus in 1 minute on hard surfaces, such as you find in kitchens and bathrooms. Use it on sinks, faucets, toilets, tile, and synthetic countertops. Any bleach-based spray like this is for only on hard surfaces. It will damage fabrics, feel harsh on skin, and produce fumes that can irritate mucous membrane. Take precautions like ventilating the room and wearing gloves. Clorox cleanup plus bleach is similar, but takes 5 minutes to disinfect hard surfaces. You can disinfect hard surfaces of the coronavirus using a solution of regular household chlorine, bleach, and water. If you have bleach, you can make your own mixture and dispense it with a spray bottle or with paper towels. Be careful and read instructions when dealing with bleach, as with all chemical products. The COVID-19 pandemic has created an additional risk for individuals with ID living in group homes. We're emphasizing the frequent use of disinfectants for various surfaces. The potential for individuals to ingest these high-level toxic solutions poses a real threat to their safety. DSPs are urged to ensure that they are safely stored and unavailable to them. I know this is particularly difficult since there are, in my opinion, ridiculous regulations that prohibit these solutions to be locked up. The concept being this is the individual's home and he or she should have access to everything. Feel free to disobey this rule and use my name as you did this for doctor's orders. Multiple sources give different bleach to water ratios for use with regular bleach. The CDC says that unexpired bleach will be effective against coronavirus in a 1 to 48 solution, or 4 teaspoons per quart. Clorox recommends a slightly stronger 1:32 ratio. Others recommend as much as a 1 to 10 ratio. Some medical disinfectants are basically the same solution. Whichever ratio you use, let it sit on the surface for 10 minutes. This is the Environmental Protection Agency's guideline for any new or unknown pathogen. and is also the dwell time listed for the regular household bleaches on the EPA's List N, which means it is approved to eliminate the coronavirus when properly used. If you see any of your colleagues working beside you, spraying and then wiping, try to remind them that they have not reached the ultimate dwell time and really are not effectively killing the viruses. Don't mix up more than you will use within a day or two. Bleach degrades fairly rapidly once taken from its original storage container, becoming less effective each day. Storing the container away from light can prolong its useful condition. If your bottle of bleach is expired, add a bit extra to the mixture and try to find a fresh bottle when you can. Be careful. Bleach mixtures can be used only on hard surfaces. They will permanently damage most fabrics, including masks and many other soft materials, and are unpleasant to work with. Wear gloves. Ventilate the space as well as possible. You'll also need to wipe it off after the 10-minute dwell time, because left to sit indefinitely, bleach can damage even resilient materials like stainless steel, and certainly can cause plastic containers to break down over time. The longer we remain in our homes, the more probable we will get cabin fever. One of our greatest needs as human beings is to feel seen and understood and connected to one another. It just may have to look a different way right now. Exercise is also important for maintaining mental and physical health while stuck at homes. DSP should be utilizing online exercise classes. Check the Special Olympics websites for their programs. Even though COVID-19 can mess up people's normal routines, it's important to keep a schedule for your individuals. I think it's very important that we maintain some sort of routine. We definitely still need to be eating meals and getting up out of bed. Getting out of bed, brushing your hair, washing your face, it communicates with yourself that, quote, I'm important during this time and taking care of myself matters. Make a schedule for your individuals to be able, to the extent possible, to communicate with friends, families, coworkers. Using the phone, computer FaceTime, and Skype can keep them connected. If you notice that some of the individuals are starting to feel depressed or anxious, then start looking at some resources, because this is a stressful time. Take every opportunity to go outside. Short walks can make a difference. Depending on your location, see if you can capitalize on the outdoor space. Garden work, chalk drawings on the sidewalk, bird watching, going to look for out-of-state license plates. It's all about being able to focus on things that can be novel, distracting, and inviting. One of the stresses for individuals with intellectual and developmental disabilities is ongoing changes in their routines, geography, activities, curtailed access to friends, families, and favorite things without fully understanding the rationale for these abrupt changes. If you are denied access to your world and placed into a realm of a new normal, the adjustment consequences become a real challenge. It behooves the DSP to counsel their individuals for the purpose of ensuring them that this is both necessary and temporary. People with cognitive impairments may not be able to understand infectious diseases, but there are ways to explain what I call regular and irregular. There are an abundance of resources, including coloring books, activity books, and stickers that you can use to help explain why things became different. They are available free and can be found on the internet. Again, the DSP is invited to use their imagination. One of the DSPs at my agency uses different colored jelly beans to demonstrate that there are all kinds of differences around us, and some are good and some are bad. We use photos of cute puppies and photos of snarling Doberman pinschers to show that not all things are nice to us. We'll also use past medical incidents. For example, Roger, remember when you got sick last week? The most important messages that you have to impart include, this will not last forever. We will be able to enjoy ourselves the way we used to. We are all in this together. We will always be there to help you. You did not do anything to make this happen. Tell us what things you want to do during this time, and tell us what things you want to do when we are able to do what we used to do. The corona pandemic stirred up quite the hornet's nest. All of a sudden, there were some extremely sensitive issues that cropped up. Concerns involving the shortage of ventilators and how would physicians decide who between two patients would deserve to get one. This boiled right down to how does society view the value of people with intellectual and developmental disabilities. Another issue was very familiar to us, and that is how policies, laws, regulations are implemented without considering how they impact on the lives of people with disabilities. These concerns prompted the actions, brainpower, and influence of several key and significant national disabilities organizations. The NADSP, working with the American Academy of Developmental Medicine and Dentistry and other groups, I immediately began to consider how people with IDD should be valued when resources were limited. How can we convince the medical profession that a person's disabilities should not be part of the decision to deny access to a ventilator? We all know that when one of our individuals has to go to the emergency room to be hospitalized, their success often hinges on the support, knowledge, and comfort provided by a DSP who is by their side. Because of the coronavirus, hospitals prohibited visitors to be with hospitalized patients. While this made sense according to halting the spread of COVID-19, it did little to appreciate the special needs of our population. Thanks to strong advocacy, make that strong advocacy by a host of strong leaders of strong organizations, we will prevail. So far, New York and New Jersey have changed their rules and will allow DSPs to enter the hospital with our individuals. Other states are expected to follow their lead, and we hope it will shortly become a national policy. The Office of Civil Rights of the United States Department of Health and Human Services has warned all 50 states about discriminatory denial of COVID-19 treatment for people with disabilities. Advocate, appreciate the role of the DSP, especially in a crisis. There's this saying about firefighters. They're the ones running into a burning building when everyone else is running out. The same could be said of the DSPs working in the trenches, going to work each day and sacrificing their safety, their sanity, and their security. On behalf of my medical colleagues, please accept our collective appreciation and admiration. Looking forward to seeing you at the next NADSP DSP Coronavirus update. Thank you.
Thank you, Dr. Rader. You know, some of the things that you talked about today, 5 weeks ago when we did our first one, were not even part of the conversation. Things like COVID toe, skin signs, blood oxygen levels. We knew about herd immunity, and we knew that testing for vaccines were going to be underway shortly, but that was really good news that the Oxford University tests are looking promising. And then the last thing I wanted to just kind of reinforce is the hospital visitation policy that you spoke of. I think it's critical that with the proper personal protective equipment, DSPs should be able to accompany a person with a disability that they support in the hospital. I think it's a win-win not only for the person who receives supports, but also for the hospital staff who are busy and stressed. To have somebody who's familiar with a person who is ill with a disability could mean life or death. So thank you to AADMD and the other organizations for advocating really hard for that. I want everybody to know that these webinars can be found on our COVID-19 resource page on the NADSP website. That's nadsp.org. You'll find all of the series of webinars with Dr. Rader, but some other helpful tools for DSPs who are working really hard during this time and need some answers. So I commend you all to visit our website, keep in touch with us, and I think most importantly, to stay healthy and stay positive and continue your amazing work. And I know that our colleagues at AADMD and a lot of other colleagues around the country are looking at the direct support workforce differently today than they were 6 weeks ago, 8 weeks ago. Your professionalism and your courage and your determination is not going unnoticed. And you have my word and the word of everybody at NADSP that we are going to advocate so hard to make positive changes for the workforce after this passes. So stay tuned, keep in touch. Dr. Rader, thank you once again. The information that you deliver is so important yet practical. And I think that's the beauty of these webinars, the practicality of really useful information that DSPs can implement on the job and implement at home. And we invite you all to share these. Share them wide, share them with everybody. We want you to spread these important webinars with everybody. So until next time, Thank you very much.